So today, as I talk about the endocrine system, there's a lot of different things that we need to really understand. One of the things is, if you think of your basic cell, you have your phospholipid bilayer, your nucleus inside, all your organelles there, and you have transmembrane proteins, and some of these proteins are going to actually be receptor proteins. What it means is, as you secrete stuff into the blood, some of these proteins that are on the cell surface can bind molecules. And so they're receptors for hormones, which a hormone pretty much is any molecule that's sent into the blood for a mass effect. If you really want to get into it, it's a way for cell-to-cell communication, and you have 4 different types. You have autocrine. The best way to think of autocrine is you make something here, you secrete it, acts on its own receptor. You also have paracrine. We have a cell here. It secretes something, and it goes to the receptor on the cell next to it. You do have neurocrine, which is a nerve going into something far away. And then you do have exocrine, where something is secreted outside the body. Usually this would be pheromones. And then you also have what's known as endocrine, where these cells secrete something into the blood, and it goes into the blood vessels and goes any distance to bind to something else. And so that's your endocrine. Now, right away you're seeing certain things. As you have cell receptors, and some of them are cell surface, some are going to be intracellular receptors, some of them are going to be in the nucleus, and some of them are actually going to be inside the nucleus. Usually what happens is any hormone that's water soluble will bind to receptors on the cell surface. The fat soluble can end up going anywhere because they can pass through the phospholipid bilayer. Now, before I really go into endocrine, I will tell you that there are different classifications for hormones. Hormones, again, is anything that's secreted by a cell to have a mass effect. And these are steroid hormones, you have fatty acid-based hormones, you have amino acid-based hormones, and you have protein hormones. Now, instead of looking at all 4 of those, what I would tell you to do originally is just look at the solubility. So you either have fat soluble or water soluble. So hydrophobic, hydro meaning water, phobic, afraid of, so those would be fat soluble, and hydrophilic, which would be water soluble. And there's a lot of little things with hormones. For instance, one of the things is, as fat soluble hormones are fat soluble, they can usually cross the cell membrane, being phospholipid. Water soluble, a lot of times are put in vacuoles, and so they are not going to necessarily leave the cell until the vacuole that you make the hormone in won't leave the cell until it binds to the cell membrane through exocytosis. And so that's one of the big differences. Water soluble can be stored, fat soluble cannot. And so water soluble hormones are usually made and stored and secreted as needed. Fat soluble are made and secreted almost as soon as they're made. There are exceptions. For instance, the T3 and T4 are actually fat soluble, but they're a little different, and we'll talk about those later. Now, besides the cell, one of the other things we really need to look at is where these hormones are. And over here, you have the brain. Now, just to make sure everyone understands, this here would be anterior, this would be posterior. And you can see the brain here, and one of the things that happens is thalamus is here, hypothalamus is here, and the hypothalamus controls the pituitary. The thalamus can actually control the hypothalamus, but one of the nice things about this is you have a lot of different hormones. Now, I'm going to start with the hypothalamus and work my way down, but remember, everything plays in with everything else. Thalamus, the hypothalamus, and the pituitary. But before I even talk about those, there's another gland I want to talk about in the brain, which is back here. And this one's called the pineal gland. And the reason I want to talk about the pineal gland first is because it's going to be simple. Pineal gland makes one hormone called melatonin, which is involved in sleep-wake cycles. The hypothalamus is responsible for a lot of things. It makes 2 big hormones. One is antidiuretic hormone, the other one is oxytocin. But these 2 hormones are making in the hypothalamus, but then shunted to the pituitary, back of the pituitary, called the posterior pituitary. But that's not all. The hypothalamus also makes most hormones that have the name releasing hormone in it. So if you see releasing hormone, it's usually from the hypothalamus. And the releasing hormones will come to the thalamus through a blood vessel called the hypophyseal portal vein system. And what it is it is a vein system which connects the hypothalamus to the pituitary and then comes back up. You have a venous system that comes in to the pituitary, and so that actually really is where the hormones of the releasing hormones of the hypothalamus are released. The pituitary, which is down here, has two parts to it. You have an anterior portion and a posterior portion. The pituitary has a back portion, which is attached to the brain. You have a little area, and you have one in the front, so this is posterior, this is anterior. So they actually talk about the different hypotheses. So you have the posterior hypothesis and the anterior hypothesis. Posterior gets nerves from the hypothalamus, and ADH and oxytocin get stored here. And when they're needed, they just get released, and it goes to different areas. Antidiuretic hormone goes to the kidneys, and it helps you reabsorb water. So in essence, anti means against, diuretic means urine or peeing, and hormone pretty much is a messenger. So antidiuretic hormone is a hormone that helps you keep you from peeing too much. And so it ends up making sure you have the right blood pressure. Oxytocin, on the other hand, is a hormone that causes smooth muscle contraction. It's involved in milk ejection. It's involved in the birth. It's involved in orgasms. It's actually involved in a lot of fun things. The anterior pituitary has a lot of different hormones. A lot of them have the word stimulating hormone associated with it. So you'll usually see the initials SH for stimulating hormone. Now, one of the hormones that it has is the adrenal corticotropic ACTH, adrenal corticotropic hormone. Adrenal for adrenal gland, corticotropic for cortex. And so this hormone will go to adrenal cortex and have you release a hormone called cortisol. The other hormones that it actually makes is, again, with the stimulating hormone, it makes a thyroid stimulating hormone. It makes the follicular stimulating hormone. And then it also makes luteinizing hormone, prolactin, a growth hormone. So usually the way it works is you can use anything here. The hypothalamus may release something like growth hormone releasing hormone, which will go to the anterior pituitary, which will release growth hormone. The other hormone that's the pituitary, that's a stimulating hormone, is the melanocyte stimulating hormone, which causes melanocytes to produce more melanin. And so that is your pituitary. If we go down, we end up finding in the neck, by the thyroid cartilage, we have a fleshy area called the thyroid gland. And the thyroid gland, if we were to take it and take a little piece of it out and look at the tissue, we would see these big cavities with tissues around it. Another cavity here, tissue around it. We'd have another cavity, tissue around that. Now these holes here are called follicles. And between the follicles, you have cells here, which are called parafollicular cells. They're called parafollicular cells. That would make the cells here, which are simple cuboidal epithelium, the follicular cell. Now, follicular cells make two hormones. One of them is called T3, the other one T4. And it's stored in the follicles. Now, this is a hormone in physiology you'll talk about being made from an amino acid. I'll let them deal with that. And it is a fat-soluble hormone, but it's stored in the follicles and released as needed. The parafollicular cells, the ones here, produce another hormone. And that hormone that the parafollicular cells produce is calcitonin. Now, calcitonin is really important because it causes mineralization of bone. What it does is it takes calcium from blood and puts it in bone. So what it's going to be activating is the osteoblast. Remember, in bones, osteoblasts build bones. So you have your follicular cells. Now, if we were to take our thyroid and turn it around, what we would find is a couple glands behind it called the parathyroid glands. So behind the thyroid, we have the parathyroid glands. And parathyroid glands secrete parathyroid hormone, which counteract the effect of calcitonin. Calcitonin activates osteoblasts to build up bone. Parathyroid hormone causes osteoclasts to break down bone. The parathyroid hormone then dumps phosphate in the urine. So what it does is it builds up your calcium levels. But the parathyroid gland goes against the parafollicular cells of the thyroid. There are a lot of different organs, which I'll just talk a little bit about, they secrete a lot of different things. And I'm going to go down the list. And one of the glands that people a lot of times forget to mention is the heart. How is the heart an endocrine gland? The reason the heart's an endocrine gland is it produces two hormones. Atrial natriuretic peptide. Natriuretic, Na, is for sodium. Uretic is peeing. So atrial natriuretic peptide is a protein hormone that causes you to put sodium in your urine. And when sodium is put in the urine, water tends to follow it. The other one is BNP, which originally was found in the brain, and that's actually why it's called BNP. What we found is it's released by the ventricles whenever the heart is failing. So if the pressure is too high, you release atrial natriuretic peptide, which puts sodium in urine, so you pee it out, and you drop the pressure in your blood. If your heart is failing, you release BNP. And that's anyone who's been in clinic may have come across something called the BNP triage. It's looking at the BMP levels. Now you also have your kidneys, and your kidney going down in your abdominal cavity, and your kidneys secrete a couple different hormones. One of them is renin. When your blood pressure drops, your kidneys release renin, which through a cascade of events ends up activating aldosterone secretion, and it does that because you have the activation of angiotensin converting enzyme, which takes angiotensinogen and converts it to angiotensin, which ends up going to the adrenal gland and releasing something called aldosterone, which causes you to increase sodium reabsorption, increase blood pressure. And we'll talk a lot about that in kidney. The other thing it actually can release is calcitrol, and that is actually it helps you absorb calcium. It helps you pretty much a vitamin D type of activity. The other thing that it can actually produce is erythropoietin, PO. You've heard of EPO. Some athletes have been using it to get an advantage. Well, that's one of them. One of the things erythropoietin that your kidneys can do whenever your oxygen levels drop. There is another gland here which is really important, and it's called your adrenal gland. It's right over your kidney. A lot of times you hear the suprarenal gland. It's adrenal gland. And it has two parts. The outer area is called the cortex. The inner area is the medulla. The adrenal cortex is divided into three parts: zona glomerulosa, zona fasciculata, and zona reticularis, and it secretes three hormones. And the first one, you secrete aldosterone. Its release is actually caused by higher levels of renin. Aldosterone will end up going to the kidney and increase blood pressure by reabsorbing sodium. Fasciculata does cortisol. And cortisol does help increase blood sugar levels when you're under stress, but there was a time where people were saying cortisol caused obesity. The truth is the obesity it causes is different. It usually causes fat to deposit in the back of the neck and around the face. It does cause some mid-level, but this is actually a pathological thing, and you can usually tell when you have cortisol levels high. The reticularis secretes testosterone and androgens, and that's usually more important. The testosterone here is usually more important for women because men have testes that secrete testosterone. In the abdominal cavity, we have another gland that we've talked about called the pancreas. So we have the spleen here, liver over here, and the pancreas secretes, you can see the islets of Langerhans here, and they have three cells: alpha cells, which secrete glucagon, beta cells, which secrete insulin, and delta cells, which secrete somatostatin. And these, we talked a little bit about GI. Just remember, when glucose is gone, you release glucagon, which goes to the liver, causing gluconeogenesis. When you have a lot of glucose, you need to get glucose into your cell, you secrete insulin, and it helps glucose go into the cells. Now, besides these two, the other hormone-producing glands, which we'll talk about in reproduction a lot, are the gonads. And this is the testes, which secrete testosterone, and something called inhibin. And the ovaries, which secrete estrogen, progesterone, and inhibin. And inhibin is a hormone which inhibits the follicular stimulating hormone from the pituitary. And the follicular stimulating hormone in the pituitary pretty much help your sex cells to be able to produce. The last gland that I'm going to talk about that people don't think about a lot of times is the adipose. Now, we talked about how this tissue looks. It's these big cells, nucleus pressed to the side, and they kind of just look like big balls kind of next to each other like this. And adipose secretes two hormones. One is leptin and one is resistin. Leptin is really important for a lot of reasons. One of the main reasons leptin is important is it tells the body, especially females, that the body's ready for has enough caloric reserve for reproduction. If you don't have enough adipose tissue in women, you can stop menstruating. And that's something that has happened with some extreme athletes and with anorexics. That's pretty much the basics of the endocrine system. I hope you enjoy it, and thank you, and have a nice day.